Bioidentical hormones are hormones that are similar to the hormones produced by the ovaries. They are natural in their source and that they are obtained from from yam and plant extracts, and they are similar to the chemical structure of estrogen, progesterone, and testosterone that is produced by the human ovaries. Compounded bioidentical hormones refer to hormones that are manufactured in a pharmacy and adjusted to the needs of the patient. One limitation of compounded bioidentical hormones is that they do not follow the same regulatory processes that regulated HRT products follow. And one downside of that there could be issues with the safety and the purity of these products. One common misconception is that regulated HRT is not tailored to the needs of the patient as compounded hormones are, and this is not accurate in the sense that regulated products are prescribed according to the needs of the patients, they are adjusted and they are monitored according to the needs of the patient, so they are tailored to the requirement, to the needs of that individual patient. There are advantages with bioidentical hormones. So a bioidentical estrogen has shown to have a more neutral effect on blood coagulation and the risk of blood clots compared to other types of estrogen. But where bioidentical hormones have a significant advantage would be when they are given through the skin, which is called transdermal. And by going through the skin, they have a neutral effect on blood clotting and as a result have a neutral effect on the risk of developing blood clots or stroke when HRT is taken. Similarly with progesterone, if you look at bioidentical progesterones, they have been shown to have a lower side effect profile compared to other synthetic progesterones, but also studies have suggested that the risk of breast cancer is probably lower with bioidentical progesterone compared to synthetic progesterones, and also a more neutral effect on blood clotting, and as a result, a neutral effect on the risk of blood clots and the risk of stroke. Regulated bioidentical hormones are available through the NHS, through a prescription from your GP or from your local menopause clinic. So you would be able to obtain bioidentical or body similar preparations of HRT that contain estrogen and progesterone similar to what your ovary would produce by getting a prescription on the NHS through your GP or through your specialist doctor.